Yes, premiums will be coming down. Yes, deductibles will be coming down. But very importantly, it's a great plan.
President Trump praising an Obamacare replacement that went through no committee hearings, is rife with backroom deals, and never got a price tag. All part of a reshaping of 1/6 of the American economy. So, what do we know about how this plan would affect Arizonans? Joining us to discuss all that and more, Dana Wolfe-Neymark, CEO of Children's Action Alliance, and John Gabriel, editor-in-chief of Ricochet.com, a conservative discussion site. He's also an op-ed contributor for the Arizona Republic. Welcome, first time. Glad to have you.
First timer.
Dana knows the drill. She's talked Obamacare here many times. Let's run down what we believe are the key features of this plan. About 600,000 Arizonans benefit from Obamacare, either through the insurance marketplace or the Medicaid expansion. Arizona's and other states' Medicaid expansion would be rolled back. Obamacare subsidies would be replaced by tax credits depending on age, and states would get more power. This is an interesting one. And if you think you're off the hook, if this doesn't affect you because you have an employer plan like most people do, Governor Doug Ducey and the legislature could define the benefits in that employer insurance plan. So everybody truly is affected. I want to start big picture first. John, for conservatives, what is the most significant piece of this bill the House passed?
Well, the most significant piece, I think, is reforming a lot of the regulations involving Obamacare and giving more power to the states, as you say, with Medicare. I think that is important, but it seems like the interesting thing about this bill is whether you define yourself as a conservative or a moderate, everybody focusing on what they're complaining about. And as you noted, we don't know a lot about the bill as information's trickling out about it because it was passed so fast.
Dana, flip it around from your perspective.
The power to the states is a loaded gun because it would force Governor Ducey and every governor to ration health care. And they're going to be the ones having to make decisions who to leave out, what coverage to wipe away. And that's because the crux of the bill the House passed are major cuts to Medicaid. It goes far beyond Obamacare. This is affordable coverage we've had in Arizona since 1982. President Obama was barely legal drinking age at that time. So this is about 400,000 Arizonans got Medicaid expansion, but 2 million count on Medicaid. Children, seniors, people with disabilities. This goes after health care for them. Okay,
so let's stick with the state and the power the governor and the legislature might get. Why is that a good thing? How could those folks up on Washington Street, come up with a better health care plan or offerings than we have now?
Well, I think it helps in that the solutions going on in Vermont or California are different from what we have in Arizona. We have a unique population here with unique needs. Now, I think a lot of state governments, whether in Arizona, I think many people here might not want that power because then they will be accountable to voters to ensure that they're being sensitive to their needs. You have different communities who know what their needs are. I think one area of improvement for Arizona is mental health services is one thing that's always underfunded. Well, now they can't say, oh, those people in Washington made us do this. Now they're responsible for it. So it holds them more accountable. It's more work for them.
That's a really good point, isn't it? They may not want that power. John McCain, acting kind of like as a spokesman for Doug Ducey, has said, hold your horses here, folks. I'm not sure we want all these people off the rolls because of what John just said.
Well, the bill takes away a federal partnership that has worked very well for Arizona. So there's a partnership in how we pay for the affordable coverage called Medicaid. And that includes behavioral health coverage, by the way, for millions of Arizonans. So by taking away the federal partnership, all the burden is on the state to deal with anything unexpected, any new costs, any demographic changes. The fact that we have a fast-growing senior population means our costs go up more, and the feds would no longer participate in that. That's a real danger to Arizona especially, but to every state in the country as well.
And speak to that, the costs. We've been talking about education. The state will not raise revenue to help pay for education. It might have to raise revenue to pay for these Medicaid costs.
Right.
That's a real pressure point.
It is a real pressure point, and one of the concerns that I have looking at it, and I know I'm representing the conservative view, but the lack of means testing and the AHCA, and I'm calling it Ryan Care because we don't know what's going to come out of the Senate.
Is it Ryan Care or Trump Care?
Yeah, I think it depends on the day. If the press is good, it depends who wants to get credit that day. But the lack of means testing is concerning. They're trying to give subsidies based on age rather than income, and I think most Americans, if you're happy with your health insurance, you know that you don't need extra financial assistance. And what they need to fix in the Senate is make sure that they aren't leaving out the underprivileged out in the cold.
Let's jump ahead to the Senate here, because people keep forgetting the Senate needs to pass this, and there's a lot of pushback right now. How should it change by the time it gets to the Senate?
I think it should change to shore up the marketplace, but to really focus on affordable coverage instead of taking away health care. So right now the bill, the way that it supposedly cuts costs, is simply promising less health care to fewer people. And I think the Senate can really reframe that and focus on how do we address rising costs, how do we address prescription drug costs, but not undermine the whole healthcare system that we have.
All right, we're going to keep our discussion going. When we come back, studies forecast a healthcare recession in Arizona if the first healthcare bill passed becomes law, the one that failed. What impact would this bill have? Stay with us.